Everyone, welcome to today's webinar hosted by the Schuyler Center for Analysis and Advocacy and the Postpartum Resource Center of New York. My name is Bridget Walsh and I'm Senior Policy Analyst at the Schuyler Center. We will begin in just a few moments, but in the meantime, in order to get to know our audience just a little better, you will see 3 poll questions appear. Please note that these are optional, but if you do decide to participate in any poll questions today, your answers are anonymous. The results of the poll will be shared during the webinar today. So we'll leave the poll up for just a minute, and thank you for completing the poll.
Hi everyone, I'm going to leave the poll up for about 30 more seconds just to give everyone a chance to answer if they choose to. Okay, great. I'm going to end the poll and share the results. And I'm going to leave the results here for just a few more seconds so we can get an idea of what the participants look like today. Great. Okay, thank you guys.
Thank you very much. Again, my name is Bridget Walsh and I'm Senior Policy Analyst at the Schuyler Center. We are excited to offer this presentation in the MOMD webinar series in collaboration with the Postpartum Resource Center of New York. The Schuyler Center is a statewide, nonpartisan advocacy organization primarily focused on improving policies for those living in poverty, particularly children and families. The MOMD, or Moving on Maternal Depression work that we are doing, is part of our continuing efforts to connect and improve care and resources for pregnant and parenting women and their children. Moving on Maternal Depression was part of a national learning collaborative to advance policies that improve prevention, screening, and treatment with an emphasis on racial equity and culturally relevant practices in policy and systems management. Here in New York, we expanded the focus to include maternal mental health more broadly. While the national project has wrapped up, we hope to develop a state-level learning collaborative that can share best practices and information on maternal mental health issues here in New York. One of the projects for the Maternal MOMD initiative is this webinar series. I also want to introduce you to our intern, Brittany Eskew, whose voice you heard earlier. She's our poll person today. She will be available in the chat for any technical questions that you may have during the webinar. And right now I'm going to turn this over to Sonia Murdoch, who will introduce the Postpartum Resource Center of New York and our speakers for today.
Thanks so much, Bridget. I'm Sonia Murdoch, the Executive Director and co-founder of the Postpartum Resource Center of New York. We're a statewide nonprofit organization helping New York State moms, dads, and families at risk or experiencing a perinatal mood and anxiety disorder get to the help they need since 1998. Our statewide toll-free helpline is available 7 days a week with additional support from Moms on Call and family telephone support. Online, we offer free access to a statewide perinatal mood and anxiety disorders resource directory. We offer education on perinatal mood and anxiety disorders through our Training Institute, including our Circle of Caring support group program and various initiatives, including Project 62, Our Vision, the Lisa Mary Riley Visioning Education Series, and Take Care of You. If you have any questions regarding any of these specific services or questions about the Postpartum Resource Center of New York, please let me know at the end of the presentation today. For those who are interested, this webinar is approved for 1 continuing education unit for New York State licensed social workers and New York State licensed mental health counselors and costs $15. Helping Hand Psychotherapy is recognized by the New York State Education Department State Board for Social Work as an approved provider of continuing education for licensed social workers, and by the State Board for Mental Health Practitioners as an approved provider of continuing education for licensed mental health counselors. Right now, Brittany will post a link in the chat for those who would like to take part in this CE unit. So before we introduce our speakers today, we would like to ask 2 more poll questions. And remember that these questions are optional and anonymous questions. The answers to these questions will be displayed for the audience to see. So thank you for answering them if you choose to. I'll leave the poll up for about a minute here.
Thanks, guys. We're going to leave the poll up for probably about 10, 15 more seconds. We're getting some quick responses. All right, I'm going to end the poll now and share the results. Thank you to those who answered. And I'll leave the results up for just a few more seconds. Great, thank you guys.
Thanks for those who were able to participate. So I'm very excited to introduce our speakers to you today. And the Resource Center, we have worked with them and their team for the past many years, actually, and very grateful that they can be part of the webinar series here. The first speaker we will have is Christine Kowaleski. And Christine has always worked with mothers and babies as an RN in labor and delivery, postpartum, Nicu, and then received her neonatal nurse practitioner from Georgetown University, and worked in a level 4 NICU for 25 years. During those years in the NICU, it became evident that although science was on the fast track to innovate treatments for the babies, there was little support for the parents. That, along with her own experience with PPD with one of her 4 children, she returned to the University of Buffalo for postmasters in psychiatry and specialized as a psychiatric perinatal nurse practitioner. Several years ago, she completed her doctorate research in early education, identification, and treatment for maternal mental health. She currently is the administrator for the Krause Family Support Program, where she has a clinical practice, oversees new practitioners, and outreach education. She loves her job, but lives for her family and is very excited to greet grandbaby number 5 in February. Our second presenter this morning is Kathleen Miller-Murphy. Kathleen is the Director of Women's Health Integration at Krause Health. As a registered nurse, her career spans over 25 years, which includes work in various roles related to maternity, care coordination, MC public health, community outreach and education, program development, and strategic planning. Kathleen has built one of the most successful Spirit of Women health outreach programs in the country, which led to the development of the Krause Perinatal Family Support Program, along with her colleague, Christine Kowaleski. She provides oversight for community outreach and education, community medical education, IRB, child and family programs, including visit to hospital land, grants, the Krause Public Health Program, and district administration for Krause Health. So welcome to Christine and Kathleen, and I'm sure that you will find their presentation wonderful with building the village for PMADs. So welcome to our speakers. So Chris, if you'd like to begin sharing your screen.
Let's see here. Okay, I think I'm sharing now. Kathleen, are you there? Well, thank you very much for having us today. When I listened to all of the bio, it seems like, geez, all that happened, and didn't seem like it took that long, but I guess it kind of did. Kathleen, if you could get our slides up, we could probably get started here. Our program started actually when I was hired by Kraus 4 years ago. I've been with Kraus actually for about 35 years, connected to them in some way. But this program, I was kind of hired through the back door. I was hired to teach nursing and spend 1 day a week helping develop this program. And so basically that was not a lot of hours on an academic calendar. So, you know, what really helped actually was Kathleen's program, The Spirit of Women. They were awesome. And I want Kathleen to talk a little bit first about what the groundwork that she laid before we actually were able to start the program.
Can you see the slides?
Yes.
Okay. Do you want to talk about the statistics first, Chris?
I can. So we do know that this is a national health crisis. 1 in 5 mothers have a perinatal mood and anxiety disorder, and we're seeing now with the pandemic that this is really becoming higher and higher, and their disease is becoming more intense. So, you know, that has made our practice expand quite a bit. We've also, now that we're doing telemedicine, we are expanding outside of our region. All of our patients are in New York State. However, we are seeing people that would not be able to drive to our office, which we're happy with because we're part of the Perinatal Center and we cover, I think, 11 counties, regardless, from Syracuse to Canada, down to Pennsylvania, and halfway to Albany and halfway to Rochester. We know that this is a crucial time when a mother has her first baby for anyone, that there's going to be a lot of change. It's a very fertile time for the relationship growth between her and her partner. And this is many times the first time a mother has felt out of control, particularly the population that we're seeing now. And I noticed that about 75% of your population you identified as Caucasian. For us, that's true as well. It might be even a little bit higher. We're really working hard to get into the communities of the lower socioeconomic population. They have a few more services than our Caucasian patients, because the people that are in the middle class, they kind of fall through the cracks because they don't live in the city and they don't have the services that are available in the city. So, you know, we're trying to kind of meet all of the needs, if you will understand that. We do know, and we do a lot of screening on our moms initially, and we do know that this can be the baby's first adverse childhood experience if the bonding is impaired. So even though we screen all of our moms for adverse childhood experiences, we try to explain to them how important it is for them to get treatment. And part of that treatment is not only seeing me or maybe taking medications, but also joining our support group. So we did create a village, and the village has so many different people in it. We have a very diverse village, which includes integrative medicine. We are involved with the local birth workers circle. We've met with the people, actually Sonia was with us when we met with the politicians locally through a wicked snowstorm. And the people just keep coming, because once they've had this experience, it doesn't matter what they do for work, they find a way to be able to help. So that's been really awesome. And again, Spirit of Women already had a team in place, so that was really helpful for us. And they were very passionate and very energetic. And I called it Booze and Balloons because they were so used to having events that every time I'd walk in community engagement, there'd be all of these boxes of donations and raffle baskets with booze in them and all these balloons. So another event must be coming on. So Kath, you want to talk about
Sure.
where I came?
Sure. So when we started Spirit of Women, it's our outreach and education program that we do for the community. And so we really did a needs assessment with our providers to see what, we thought we knew what they needed, but we wanted to actually ask them what they needed. So resoundingly, lack of services for maternal mental health came up from every provider. And honestly, they were not screening women for depression because they had nowhere to send them if they were positive. So they kind of were just glazing over that piece, which, as we all know, is critical to the whole health of the person. So we developed the program before Chris joined us, I had met with our senior leadership team and our great chief nursing officer, who was phenomenal in all this and helped us create this position that didn't even exist because, budgetary restraints at a hospital are difficult and even more so now. But we had a lot of support from the top down as we developed this program, and that really did help make all the difference. And as we go through, you'll kind of see, as Chris said, we have multiple partners and from all different areas, and it really is a village. And we, everyone we went and talked to, whether they were, our local mayors or they all had a story. They all had a story that related back to maternal mental health somehow. So it was an easy way to get support because folks really had not been talking about this, and we wanted to make this a conversation that was going on all the time within our community. So we did a needs assessment. Physicians were very uncomfortable managing maternal mental health, as I had said, especially medications. We did do a SWOT analysis and created a strategic plan around, 5-year strategic plan around maternal mental health. And I'm happy to say that we completed that early because we have a really great team who worked really hard to make that happen. So as Chris said, we did hire her through the back door as an employee of the College of Nursing, and she split her time helping to build this program and educate the community. So we'll talk a little bit about the hospital piece a little later, but one of the big priorities was our NICU moms who, as you know, families in the NICU, many experienced PTSD, and we as community engagement would go out into the community representing Krause Hospital, and we get a lot of folks coming up to us, grandparents even telling us how difficult it was that, their grandchild or their child and what they went through when they were in the NICU. And, our NICU is very busy. I think today we have 67 babies there, all very high acuity. So we have some sick babies, and those families need the mental health support as well. And then development of our community support. We did do some fundraising. We had our Marching for Mothers, and it was fundraising, but it was also an opportunity to reach out to the community and educate them. We talked about maternal mental health and support and what to look for to anyone who would listen to us, you know, TV, radio, anywhere in the community groups. And then in 2016, and I'll talk a little bit more about this later, we did start screening all the moms who delivered at Crouse, and obviously had some plans put in place for how we would facilitate the care for them afterwards. So if you're considering building a program, first of all, I want to say we are here to offer any advice that we can, or assistance or help, because this is very important work to all of us on a personal level as well. But one of the things we really looked at when we did our SWOT analysis was, what do we already have in place in our community? You know, we have some great therapists, some great social workers, some great community health workers, some great doulas. We have a lot of the pieces. And then we looked at, you know, who and how can we partner with them to kind of grow our circle and create opportunities for families all over our community. So this is what our perinatal family partnership looks like for us. And it involves the NICU, our Kinsel Maternity Center, as she said, integrative medicine, our psychological partners, community partners, and outreach throughout the region. So this is kind of what our model is about. So the one thing I would encourage folks is to really create some goals. That really helped us drive where we were going and what we needed, and kept it constantly on the forefront. And those short-term, mid-range, and long-term goals were incredibly helpful to move us forward. And the other piece that Chris will talk a little bit more about as well is to choose your champions. As I said, we had a chief nursing officer when we started that was phenomenal. Our CEO, Kimberly Boynton, very supportive. Our department reports to the chief medical officer, Seth Cronenberg. You know, they have been champions for us within our organization, but also the champions that we picked up along the way throughout our community, and the moms that we've served and worked with, because they are great advocates, and their stories are very powerful. So Chris, you want to talk about the training for the staff?
One of the things, and it's interesting because Sonia and I have worked together for so many years, and even though we live in the same state, I think we met in California. And she said to me at one point, we might meet each other at a conference. And so here we are, thousands of miles away. But one of the things that became really evident over the years was that Postpartum Support International was the training platform. So one of the things that we did have a grant, and we decided that before we could really offer a program, we had to have people trained. Just like the doctors didn't want to do screenings because they didn't know where to send them, we had to create this team where they could feel confident sending. Was trained. So everybody from the people answering the phone and community engagement, to those doing intakes, to our facilitators, went through the Postpartum Support International training. And we also were able to offer that within our region to 5 or 7 different hospitals, where we asked them to identify 2 to 3 people, and the grant paid for their screenings as well. We did have in our community, we have what's called the Birth Workers Circle, and that includes doulas and chiropractors and massage therapists, and many of them also have taken the training. Because we want to be able to tell, one of the things is moms are struggling enough. We want to be able for them to be hearing a consistent message. You can see in the picture there, that's me. I said to Kathleen, I don't think I like that picture of me. I look really big, big. But anyways, that's actually another staff person. But Raymore and Flanagan donated that furniture to us, and we thought that was going to be our living room to see patients until we realized we were too many feet away from the hospital for me to prescribe. So it was not a patient care area. So we ultimately moved to down across the street and have a beautiful office, which you'll see later in the slides. Oops,
sorry.
The other picture is one of our support groups where our, I think at that point they were probably getting maybe back massages. We had massage therapists that would come to our groups. Clearly that was before COVID. And we were upwards around 15 moms a session that would come, and they didn't want to leave. They stayed in our group a long time, sometimes until they had their next baby. But they were actually a really good inspiration for the new moms coming in, and they took each other under their wings. So I really say to them when I have a new mom that I consider part of their treatment plan for them to attend a group, be it our group or a PSI group. Okay, you can go.
Okay, so as part of the hospital end of our screening process, we also did training with all our staff in our maternity area as far as perinatal mood and anxiety disorders, so that they understood not only what to look for, but what the resources are for the families. So for our organization, we'd use the EPDS, and anybody who scores above a 12 immediately gets social work follow-up, and the social worker will go in and do an evaluation, see what the needs are, contact our program if it's somebody they really are concerned about that they want, Chris to see pretty quickly, we'll accommodate that. But it also is a opportunity to get them in to see their OB provider within a week or two. So we want them back earlier than waiting. And, we also tracked, we have data collection through our IT department has been phenomenal. They built our screening and everything into the EMR and automatically generates orders as needed. But it also generates a report. So every month I get a report that tells me how many patients delivered, how many had screenings, how many were positive, how many had appropriate follow-up. And it was a good opportunity in the beginning, especially for us to look at provider practices that maybe were not following up with these patients until a 6-week checkup. And then to be able to have Chris go out and do some education with those practices. And we saw a huge shift in that. And now we have, around 98% compliance for that. So that was a big education piece that we also did. And Chris, Chris is phenomenal because she'll go out and she'll speak to anybody, we're like, Chris, you need to go talk to this person or that person, and she will go ahead and do that. So we did have a big project with our IT department to kind of create all those things within our EMR and then be able to create reports around that. The NICU, Chris, do you want to talk a little bit about the NICU support? Because I know that's your
that's my baby. My baby. Yeah, so I think one of the things that really resonated with me was watching us it happened every day. We take monitors off a little frail baby that's been there for 3 months and take the monitors off and tell them, the mothers, okay, now you can take the baby home. You don't need a monitor, although you needed a monitor all night last night, but now you don't need it. And we're going to send you to Bowkville or wherever we're going to send you where there's no medical care. And we're going to tell you not to have company and not to, all these restrictions, and then give you this list of signs and symptoms of the baby getting ill, high temperature, low temperature. And, the parents really just had this look on their face like, you know, even though they may have been preparing for this day, like, wow, what are we going to do? So we did develop one of the first groups we had was in the NICU. And so we have a social worker that meets with them weekly. And they have a lot of topics, but they also always try to include education and the education on going home and what they're, you know, to find out what their resources are in their own community. So this is a time away from the baby's bed where we know that when they are in the NICU and next to the baby's bed, that they're probably only hearing a quarter of what anybody's saying to them. In fact, many times they would say, I haven't spoken to a provider and they talk to me every day, and they would forget, you know, like who's a provider, who isn't. But anyways, I think that's been really wonderful for them. And then as far as special appointments for emergency situations, that would be in the case where the NICU would call, and right now everybody's working from home, so it's not as easy, but when my office was right across the street, it was very convenient. The mom could just walk across the street. And with my background with the NICU, I could actually speak that language. And I'm trying to teach that language to our new NPs, because we do have an educational program where students, like NP students, do come and do a rotation with us. So yeah, so that's worked very well. Kathleen knows everybody in the world, all these community partners.
So I know we've talked about many of these community partners. One thing I will mention, you know, we created a great partnership with the YMCA of Central New York, and I know there are a lot of Ys in all of your communities, regardless of your Western New York, Albany, wherever you might be located. But we met with them and did some education for their staff as well, because a lot of new moms are going to the Y. They have daycare or childcare if you want to work out, that kind of thing. So we actually negotiated for a free membership for family membership. So anyone in the family could go, but it would provide an opportunity for childcare, and sometimes for our moms just to like go take a shower, or something as simple as getting a cup of coffee and sitting in the lobby. And if they felt, you know, like they wanted to work out, that was okay too. And frequently when we first get them in group and they're kind of struggling, you know, maybe after about 6 weeks, they are starting to feel better, and then they will utilize their membership. So they have been, the Y has been very generous. They've been a really great partner for us to be able to facilitate that for our moms. Chris, do you want to talk a little bit about the program for the libraries that you put together?
So when we were during May, Maternal Mental Health Month, and we were trying to decide how we could do an awareness program, actually Sonia shared some of the things that they have done in Long Island. And so we kind of spun off that, and we had 62 libraries in our community and within the Onondaga County area. And we were allowed to put educational material in all of those libraries, and we donated books to them. The book we donated was by Karen Kleiman, called Good Moms Get Scary Thoughts. So we donated, I don't know, maybe a dozen of those books to them, and had a presentation with our county executive when we did that. So there was some PR with that. And you know, it was actually, it was put up in the children's section, which was great, because moms will take their kids into the children's section, but it's like anything else, they're more interested in what's best for their baby than what's best for them. So that was good. And then at the New York State Fair, that's the biggest event, believe it or not. That event draws more people than any other event in New York State, is the State Fair. I don't know if it's the sausage sandwiches or the pizza free or what it is, but they started putting up these nursing pads a couple of years ago, so that instead of the moms, like when I had my baby, sitting under a tree and nursing your baby, you were able to go into this nice air-conditioned pad that was kept clean and sanitized, and you could change your baby and nurse your baby. And so we thought, well, this is a great opportunity for people to learn about perinatal mood and anxiety disorders. We could put educational material in there. And so we contacted them, and the response we got was, everybody wants to advertise in there. We're not doing it. Nobody can have any information in the pods. And we just persevered and, sent them information and educated them on perinatal mood and anxiety disorders and the risks, the suicide rates, everything. And they said they didn't want us to have something that was like an advertisement directly to us, but the information and places to go for help we were able to do. So we made a special flyer that was put under glass. It looked very nice. They accepted that. And so they were putting all the nursing pods, which was a big deal, really, for education for these moms. And we did get a number of calls from them. I don't know if Sonia got any, because again, we put the Postpartum Resource Center knowing that many people come to the state fair that don't live in Syracuse. So it wasn't really about advertising our program. It was more about education.
And Nicentia Health is a home care agency here in Central New York that we work with. And they were a great partner. We did a lot of training for their staff, but they also provided iPads for moms and would do daily check-ins. So if, we had a mom that we were really worried about, we could connect them and they would do it 3 questions each day on mental health, just to kind of do a check-in and then reach out to us if it was somebody we needed to make sure we were following up with. So that was a great partnership as well. And I think Chris talked earlier about the birth worker circle and the community health workers and doulas and those kinds of things that we had.
I think also with Nicentia, if they do have a high score on their EPDS in the hospital, they get a referral for Nicentia. So that's basically our community nursing for them to go in and check on the mom. Yeah. So that partnership is really great. That was a really, that dovetailed very nicely into us screening moms in the hospital.
Yeah, and it gave us additional support. And we try to kind of build that wherever we go, because there are a lot of moms out there, obviously, and there's one Chris right now, so.
Okay.
Chris talked a little bit about this, our grant. We did educate through the PSI program. We had over 80, all different folks, physicians, social workers. We had community doulas, all kinds of folks that we were able to provide training for through PSI, and then they can sit for their exam after the 6-hour course. So, that's all part of building the village, is to get as many providers as we can well-versed and understanding the needs of this population. Chris, do you want to talk about our program we did with the providers?
Delagianis come from Northwell, and you can see her up there. It does look like Sonia and I got the memo, and I don't know if anybody else did, to wear the blue coat. Yep.
They match every time we go somewhere.
But anyways, so in some of these pictures are some of our local politicians. The county executive is Ryan McMahon, who's up in the corner with us there. Then we had Dr. D with us when she came and spoke. And then the deputy mayor, Sharon Owens, over on the top right. And then we have a county legislator with us. And what the heck is her name? I can't remember. Oh my God, it escapes me. There's so many people. at any rate, you can see how that auditorium holds, I think, 180 people, and we were full. We had to send people into another room where there was overflow and stream it in there when Dr. D came. But it was amazing. And it's 7 o'clock on a Friday morning, no less. So people are hungry for this information.
Mhm.
So I think that, you know, we just have to continue to educate. And people came from distances and spent the night in Syracuse to be able to do that. And then the following day, Sonia, I believe that was when she did her training for the doulas. So we try to, as much as we can, coordinate so that we can offer educational programs to a variety of different individuals that interact with the new moms.
And we also, we did a program that was OB Grand Rounds, and that we included the residents because, you know, they're our next group of OBGYN providers. So we really wanted to include them in all of this so that they had the resources going forward as they go out to start their own practices as well.
It was a very powerful
Yeah.
presentation because
Yeah.
unfortunately, tragedy gets a lot of attention. And we did have a tragedy in our community, and the family came to us. Unfortunately, our program was not up and running. We were about 6 months shy of being available to this family. So it was after the fact that they contacted us for support, and they were amazing. They came and spoke to providers after losing their daughter, and you know, I think it really, there wasn't a dry eye in the room, and it was enough for our administration to say, do this program.
Yeah, absolutely.
So this was a book that I created because what I was finding was providers were not sure exactly what to screen patients for or why they would use certain screening tools. And this has been endorsed by Postpartum Support International, and it's a booklet. We can send it electronically as well, but I really think it's helpful to have the booklet in your hand. Maybe I'm old-fashioned, but it talks about every screening tool in the booklet and why you do those tools, because there is a rationale for it. It's not like we want you to hand somebody 5 different screening tools without some kind of rationale for each one. What we were seeing is women would come to us in manic states after being put on high doses of SSRIs, or they were on an SSRI without a lot of education, and then they didn't understand the side effects. So the tools, they're basically, we do an ACEs screening, we do a suicide. Every visit, the patient gets a suicide screening, because when you look at the statistics for suicide, people, men, women, whoever it is, they will go see their doctor multiple times in the last, you know, the few months before they make the choice to commit suicide, whether they're talking about their emotional state or not. So when people are so depressed, they do have aches and pains, and they do not feel well. So my feeling is when everybody goes to see their physician, they should have a mini depression and suicide screening. That, you know, but it's just because I come where I come from. You know, so we also have some other tools in there. We do a mood disorder questionnaire, because that's one thing that we see so much of is their first episode of bipolar 2, it occurs postpartum. And I can't tell you how many times as I'm doing their intake, I find out they have a sister with bipolar or a mother with bipolar. And we try to normalize as much as possible. So so each tool is in there, the explanation for each tool is in there, resources are in there, the Postpartum Resource Center is in there. So it's not something that is just looking at our small community here. It is for, you know, like anybody, and there's a pocket in the back where you can put your local resources, but I think there's enough in there that it could go any place in New York State or even the United States, and people could be able to know what to do and how to do it. The idea of point of entry to care is this should be done the very first time they're hearing a fetal heartbeat. So not the very first visit, but sometime in the first trimester.
Great, thanks. And one of the things that Chris did mention is dads, and we do have dads that are in our program that Chris meets with, and they certainly can have the depression as well. So that's another group that we try to do some outreach and education. It's a little harder with the pandemic. We had planned a group for dads, but we kind of are on hold with everything going on. So this is our new space. You'll see on the right upper corner here, that was our old space. And then this is the new office space. We moved into Crouse Medical Practice, which is right across from the hospital. And we, again, Raymore and Flanagan donated furniture for us. And this, believe it or not, is an exam room. We have 2 of them. So this is our space. It's warm, it's inviting, it's relaxing. We have, if we need to have the massage therapist, if they're available, they can come over and use the other room. One of the rooms is just for Chris's office, and she sees her clients there. So we just wanted it to be somewhere moms could just come and take a deep breath and focus on themselves for a little while.
I will say they don't want to leave. They're like, when they're done with me and I say, I really do have another patient, they'll say, oh, can I go in that other room where the walk room is?
And we put this together in record time too, so. Here's the book that Chris was talking about. We do, as we said in the beginning, our program is through community engagement as the department that our facilitators, we have a group of per diem nurses that work as facilitators that have been trained, and office staff that have all been trained. So we, wherever we go in the community, we talk about perinatal mood anxiety disorder. So we do a walk every year, and it has grown exponentially, and it's a lot of our families who have been through the program. They bring their whole family out. But it's a great education, outreach, and support. And it's nice to see them doing well and, you know, coming to see all of our team.
Part of what we try to do is get rid of the stigma, normalize this. And, you know, I think that when we have an event like this, and Kathleen knows how to make events fun, you know, so it becomes, oh, what's the event in Syracuse this week? Oh, Marching for Mothers. Okay, we'll go do that. And then they learn about all of this, and they're not, you know, they have the education to help their friends and family.
So this is, oh, sorry, too fast. So this is our 4th year of serving patients and families. We opened our clinic in June with 1 NP. We just hired another NP that we're so thrilled about. And she's going to be a great asset to our program. And so, you know, to get 2 phenomenal psych NPs is, you know, like winning the lottery. As you know, it's hard to find providers. So the fact that we have 2 phenomenal ones, I feel like I won the lottery, and it's going to help a lot of our families. We've served over 800 patients, facilitated over 80 professionals receiving training towards certification. We talked about the NICU in the beginning. Chris did talk about the integrative medicine piece, the technology, and the art therapy. And when we were meeting in person, we would try to once a month for support group have some kind of art therapy, whether it was painting or writing or just something to kind of give them something to accomplish and feel good about. And our moms really appreciated that. And a lot of the dads would come to those programs as well, because they would say it felt like they were a normal mom. And that's the feedback that they would give us. So just giving them tools to use for their own mental health. And of course, you know, in this time we could all use that. And constantly doing continuing education out to the providers, the staff, and the community has been critical for this program.
So I don't know how many people in the audience have done the 16-hour training with PSI, but Kathleen and I have been talking about it. We're due to do a 6-hour training to get folks ready to take the exam. So
the more the merrier. And for us to, you know, as an organization, you know, we are physically attached to one of our competitors, like by a bridge, like actually physically attached to a competing hospital. And you know, this was not about competition or who was getting the market share or anything like that. We have trained folks at every hospital. We have built partnerships because we don't have psychiatry at our hospital, inpatient. We went out and built a relationship with Upstate who does, and Chris can direct admit patients if she needs to. So, you know, even though we don't have a psych service line per se, we're kind of able to utilize our community resources. But we wanted this just to be about the mental health and wellness of our community and all the communities across the state. So we, you know, we reached out to everyone, you know, our competitors, everyone we could think of, and everybody stepped up and provided staff that were willing to be trained. And I think, you know, that says a lot about our program and our goals and, you know, what we want is around perinatal mental health for our families. And that's really the only way to do this, is to create as many supports as we possibly can for our families.
And I think now that we're doing teletherapy, we can really expand our geographical area. I mean, I love to see people in person, but as long as I can see them on the computer, it really is, might not be optimal, but it's better than them not getting treatment.
Right, yeah.
With some of our little twins, yes.
And so for anybody who would like a copy of the point of entry into care, if you can just type your info in the chat, then Brittany can get that to us and we can mail those out or email them or however you'd like, electronically, or if you want a copy, just let us know. Brittany, are there any questions that we have?
Thanks for doing that. I'm actually just typing in the chat too to let everyone know that if they're interested in the book, they can add their information. Okay. Right now, it doesn't look like there's any questions. There was a comment that came in a little earlier talking about the 4th trimester, that there had been discussion about the 4th trimester with moving up the postpartum follow-up to possibly 1 to 2 weeks postpartum. And maybe that could provide additional support for new moms and families to identify PMD or PPD. So that was just a comment here.
Yeah, so that was actually my doctorate research. I saw patients in a very large practice at 3 weeks postpartum and did an education piece with them and screening. And then I saw them again. Oh, I didn't see them again, but they had their routine 6-week EPDS. And what we found was there definitely was a statistical difference if they got that psychoeducational information and information about where to go if they are experiencing PMAD signs. So the fourth trimester is complicated with physicians in that they get, there's always been, you get this much for delivering a baby. And with ACOG adding on, you should have a fourth trimester and see them for 12 weeks. That makes all kinds of sense. But it doesn't, you know, everything is cost-benefit ratio. And so some of the younger doctors will do that. And clearly, if they have a high EPDS in the hospital, they are seen within a week or two if they're a physician. So that has made a big difference for the patients who have been delivered at our institution. And, you know, I just think that seeing them at 3 weeks, it doesn't have to be a physician. It can be a nurse that does a little education. How are you feeling? Give them the EPDS, tell them where they can go for help. Because when they're pregnant and we tell them all this stuff, they don't think it's going to happen to them. So it's one of those things like, yeah, okay, I'll put this in the corner with all the other stuff that I got.
Thank you. I actually do have another question that came in too. Are you guys doing any in-person visits for clients who are pregnant right now?
For people that are pregnant, we're also using teletherapy. It's just easier all the way around because it frees our schedule up so much. It's not that we can't. I think during this new uptick of COVID, at least in our area, we won't be doing inpatient for a while. But we usually get people in. I had a little bit of a stumbling block here when I had some surgery, but normally we would see a new patient within 2 weeks, I would say, which is, again, unheard of for psych MPs. But that's only because of the strength of our team and the people that are doing the intakes.
One of the things that we didn't talk that much about, but if anybody would like more information, is our groups. We do offer virtual groups twice a week. We did increase that. And so we see about 8 to 10 moms at group. And then our intake is through a self-referral line. The numbers on there are warm line. And, you know, we recommend having 2 facilitators, definitely when we're in person, but also, you know, sometimes that second person is really helpful when you're working with a group, especially if somebody's really kind of having a crisis. And, you know, we see that sometimes. So anyway, if anyone has any more questions, here's our information. Feel free to reach out to us at any time. We want to thank the Schuyler Center, and we want to thank Sonia for all the work that she has done with us in the Postpartum Resource Center. You know, I think we're really fortunate in New York to have some good resources for our families that they can use, and certainly we appreciate those partnerships an awful lot.
Well, thank you. Thanks so much, Christine and Kathleen, for your wonderful presentation. Also, it's a great pleasure to work with your awesome team. And you definitely, you know, I know one of your themes is dream big or go home. And it's terrific to have you share the progress, the hard work that you have all, you know, worked together, and the progress that you've made. And it's wonderful that I want to say, you know, just thank you so much that you were able to be with us here today and share the support program that you have helping families. So with, you know, we do have maybe a couple more minutes for more questions, but before going on to that, we do want to ask one more question of the participants here today regarding the material of this webinar series. So we want to use this webinar series as a way to bring together professionals in the field of perinatal mood and anxiety disorders and grow this network. So we encourage everyone, if you further have any other topics that you would like to see included in this webinar series, please add them to the chat right now. And also a reminder with Christine and Kathleen's offer to send you their Pathways to Care book. So if you'd like that, also include that in the chat. So I would, at this time, open it up if anyone wants to share their screen, ask any other questions. Here's your opportunity. So let's see, Brittany, if there's any other questions coming in, or if anyone wants to, you know, share their screen. Questions, comments?
It looks like the chat is dying down a little bit. We are getting a lot of thank yous from the participants. So definitely thank you guys today for sharing.
Okay, so I think we're wrapping up then.
We're always up for a roadshow. And
So